should at least three elements: the susceptible host, human, and etiology, maybe virus, bacteria, something, and the favorable environment for transferring the agent to the susceptible host. It's worked for many of infectious diseases. But we should think about non-communicable diseases, non-infectious diseases, something like diabetes mellitus or something more complicated than an infectious disease. So it's the simplest model for the disease to describe how the disease will happen, and we have more complicated one. And if you know the model of the disease, you can intervene to prevent the disease. For example, if you cut the relationship of environment, so the disease will not happen. If you cut the agent, the disease will not happen. If you immunize the host, so if you intervene the susceptibility, the disease will not happen. If you have more than one strategy to prevent the disease, it will be more successful. So for preventing, for example, malaria, we use some some toxins and some environmental intervention to remove, for example, the water, extra water in some area that the mosquitoes
biting for it.
Increase there is something. If you use some pesticides in the house environment and we don't have any malaria, but if we prescribe some remedies, for example, for malaria, for travelers, we ask them to get one pill a day, and the name of the combination of atovaquone and proguanil. And the name is chemoprophylaxis. So it's this prescription is which level of prevention for travelers to the malaria area? Primary. Yeah. Yes. To prevent the disease to be happened. Okay. The natural history of the disease, we spoke about that. Different. Here the prevention means primordial and primary, before the disease happens. Here is not included quaternary rehabilitation, cerebral. This is the examples of the prevention, lifestyle vaccination, screening, rehabilitation, and considering over treatment to prevent side effects. Okay. Other method that we can find health problems in the population is surveillance. We as a doctor could stay in our offices and wait for a patient to come and ask the symptoms, check for signs, examination, perform some diagnostic methods, and perform treatment. But as a health decision maker, okay, we should consider the disease in the population. We should aware about the peak of the diseases, and we should prepare the hospitals and health centers for surge of the patients. For example, in the corona epidemics, one of the works of the epidemiologists was to predict the peak of a corona disease in, for example, next month. Because the government wait for some strategies to shorten the peak of the disease because of the low beds in the hospital, low drugs and low vaccines at the first early stages of the epidemics, and they want to perform some strategies for quarantine to stopping the works, the schools, and something else. And they should know the effect of the quarantine on the peak of the epidemics, because the quarantine equal to low economy, and it's not good for the country and government. The surveillance system is a systematic collection, collation, analysis, interpretation of the data, and the dissemination of information to those who need to know in order that action may be taken. Information for action. And the data come from the hospital, from health centers, from your office. So some disease in interest should be reported by you to the related health center. If it has a high emergency, you should call the center. Otherwise, there are some forms and papers you should fill in them and send to the health center during a week, for example. Okay? For example, something like cholera, vaba, is vaba. Cholera, diarrhea is emergent. You should call if you find a disease in your office. But the cholera will not go to your office. In your case, in dental office, you may see some oral lesions related to syphilis, for example. Okay? Syphilis in Iran is one of the diseases in the surveillance system, for example. Or maybe you will, if a patient with some signs of oral lesion in HIV/AIDS come to you, you should report it. Which disease? Sarcoma, HIV/AIDS. Disease surveillance and response. Effective communicable diseases control relies on an effective surveillance and response system that promotes better coordination and integration of surveillance function. Recognizing this, the initiative to strengthen the disease surveillance system that promotes the integration of surveillance activities in Ethiopia was started in 1996, for example. If the surveillance is important to the government and health decision maker, they should actively gather the data. Okay, so they may send some staff and get some personnel to the hospital, and maybe in those areas that reported the disease, and they go door by door to find more cases. Actively they gather the data. Otherwise, if it is not so much important, the surveillance system passively gather the data. So they wait about your reports to them, and they don't come to you and ask about the new cases. So we have active surveillance and passive surveillance. And there is a cycle for assessing risk, prioritizing public health threats, assessing existing systems, developing a strategic plan to action, plan implementation, and monitor the progress of the system and evaluating outcomes and impact. So the data gathering, as I mentioned in the here in the definition of the surveillance, we should take action to prevent further diseases and shortage of resources. So we should always perform evaluation in all projects. For example, here for surveillance. Of monitoring and evaluation of a surveillance system. For example, in case of, do you know which diseases are eradicated from the globe, from the earth? Which disease eradicated? The smallpox. Okay, the smallpox. We don't have the smallpox yet. The white virus was escaped by US and Russia. If there is no leak from their laboratories, we don't have smallpox. Okay, in list of eradication, which diseases are? No. Rishikani. Eradication means eradication of infectious disease. Eradication means we perform some activities to eliminate the cause of disease from the world. So you can't find any virus of smallpox in your environment. It means eradication. For HIV/AIDS, we perform control programs to limit the transmission from patient to healthy people. We can't perform eradication for HIV/AIDS. For example, they tried to eradicate malaria, but it's failed. Guarantee for corona is control of epidemic, not eradication.
Diabetes?
So COVID is something like influenza. We can't eradicate influenza. So diabetes, no.
Inflammation?
Inflammation. Teeth inflammation for eradication. Eradication from the globe, from the earth.
Oh.
Yeah. Think about a bacteria or virus. Think about the virus. Fever is a symptom.
Bacteria?
Polio. Yeah, good.
See?
Polio.
Polio.
Poliomyelitis. We study for فلج أطفال. Yeah.
Polio, it is a drug.
But, however,
so it would drink.
some years we involve new cases from Afghanistan and maybe Pakistan.
Right.
So these two countries remain for final eradication. and all countries have surveillance systems to control the trend of poliomyelitis in their country. Okay? For evaluation of this surveillance, because for example, in those countries there there's no case of poliomyelitis, how we can rely on the surveillance of the country? There is no report of polio. So the surveillance is active or not?
Not active.
How it's it should be active? In many countries, there is no case of poliomyelitis. So how we should think about the activity and the sign of living surveillance system about the poliomyelitis? So they define something else in relation with poliomyelitis, that the statistics of that is known, and it is acute flaccid paralysis. Acute flaccid paralysis. So the incidence of acute flaccid paralysis is known, and they should be reported because of other viral diseases, because of some side effects of some viruses. We should have some paralysis in children, for example. And if the surveillance don't find these cases, so the surveillance have some problems. But if they report continuously acute flaccid paralysis, so they could find any cases of polio if happen. Okay, so if somebody says what's the difference between outcome and outbreak, outbreak and epidemic is completely equal. In some cases, maybe they said that outbreaks happen in a small area and epidemics in larger area. For example, a food poisoning in a campus or in a ceremony is an outbreak.
In short,
But yeah,
nothing.
nothing. But the epidemic of infectious disease in a province or in a country is an epidemic. So early warning to inform appropriate and effective public health response to determine the distribution and spread of disease, illustrate the epidemiology of new disease, and provide information to categorize the other. In some cases of surveillances, we do not speak about a disease. We speak about the symptoms, or more specifically about a syndrome. So we have some syndromic surveillance systems. For example, in war and military, because of the unknown agents may be used in the war, like biologic weapons, they define some signs and symptoms together, make a syndrome. And they said that if you find a soldier with these signs and symptoms, report them to the surveillance system. So we have some syndromic surveillance. So it's detected disease earlier instead of disease surveillance. So syndromic surveillance is better than disease surveillance. Timeliness, as I mentioned, some diseases should be reported by telephone, something in a week or a month. Outbreak investigation. For outbreak investigation, there are some steps to stop the progress of the disease and to prevent further outbreaks. And it has some byproducts such as training the system and preparedness of the response system. The steps are listed here. If you get some reports, you should at first confirm the reports. Maybe the doctor makes mistakes for the diagnosis. So you should confirm it as a health provider in your area. and then you should gather a control team from administrators, from specialties, from epidemiologies, if it is microbiology, and you should invite some people from media to communicate with the community, okay? Then you should define a case, and by definition, you should
cases.
get further cases in the area to perform a study of the time of disease,
Place and
and
person.
place and the person, to make
I
some
see.
hypotheses about the cause of disease. So, about the cause of disease. And you should compare the patients with healthy people to find the cause of disease. For example, in case of food poisoning, you should ask the patients what you eat in the dinner, for example. Do you eat salad? Do you eat egg? Do you eat fish? Do you eat blah blah blah? You should ask same question from healthy people. Okay? The differences between these two asking and interview find the cause of food poisoning. For example, maybe patients eat more salad but not healthy people. So the cause is salad, yeah. And if you find the cause of outbreak, you can intervene and communicate with different parts, with people, with doctors, with health centers, and so on. And finally, after control, you should perform evaluation. Always you should perform evaluation. And in case of outbreak investigation, for further learning and training, is documentation. So all the works performed here should be documented, maybe published or not published. It should be get in the government and health ministry, in the related department. So evaluation and documentation should be added to this slide. Short break.